Hello, I'm Rachel Dunscombe. I'm CEO of openEHR. I'm visiting professor at Imperial College London, formerly a CIO as well. And it's fantastic to be with you for the Europe India Digital Health Week. I'd like to talk to you today a little bit about AI and data. I've been the lead AI policymaker on the AI Council for the UK government and also chaired the AI Club for the Digital Health Society. And we across the globe have got an issue with AI. Basically, AI is what it eats. If you feed it data that is poor, it will perform badly. And we have a huge history of collecting data that is really just fit for reading in a letter or human use. And this was brought home to me a number of years ago. I was actually CIO of the most digitally mature organization in the NHS, where we had a number of algorithms, a data science team, our clinicians were all educated, some to MSc level in AI and data science. And we found that our biggest issue in actually progressing with these at scale and pace was the data. We didn't have the data that we needed. It wasn't clean, codified, real-time data. It was collected in different ways. An example I give you is some work we did around length of stay, where we found that within our EMR, we just thought we would find one length of stay, but there were actually 15 different places where length of stay was stored. And so it became very clear to me, which is now why I'm working in data standards with the likes of HL7, SNOMED, and other organizations, that we need to get our data engineering and our data environment right for the future in order to power AI. And in more recent times, I've been working with generative AI. So actually taking large language models and then giving them factual data sets as well, and asking them to, represent those factual data sets to clinicians or patients. And the learnings from that have really been that we globally need to make sure that we have the right data going into these large language models, because they become dangerous instead of a utility until we have that sort of great data. So data engineering and actually having data as first-class infrastructure is really important for the future. So when I say first-class infrastructure, today we build hospitals, and I've seen some of the lovely hospitals that are being built in India. Europe's, built a number, and here in the UK we've got 41 new hospitals being built. We engineer that really well. We make sure structurally it's correct, it adheres to standards, and that it's fit for purpose. We don't, however, do the same with our data. We don't make sure, that it's fit for purpose, adheres to standards. And when I say fit for purpose, the data we collected in years gone by may just have been to put into a letter at discharge, but now that same data that we collect needs to be fit for purpose for many uses. One thing I do say is data is for life. And when we collect data now, that data will be used in the patient record for risk stratification. It will be used in population health. And we need to collect data once, but understand that it will be used for many purposes. So it needs to be codified and correct. Now, that journey globally is a huge journey to go on. And I was with the policymakers from India last week in Maastricht, doing the International Policy Forum, where I was actually facilitating the session. And we were talking a lot about the different aspects of this. So if we make data a first-class infrastructure, we need to make sure it's secure. We need to give transparency to the citizens. We're talking a lot about cybersecurity. We also need to make sure that we have international standards that are commissioned globally, if possible, possibly via the GDHP or another body, to make sure that we're all working, to the same sort of rules. And if we're going to have a global marketplace as well for AI, all of that data work needs to take place. So spending time now thinking about our data and working on our data is very important. It's more important to me than actually pressing ahead with all of these AI initiatives. The reason being is we will have lots of false starts, we will do things wrong, and we will harm people. if we press too hard on AI without getting the data foundations right and getting that first-class infrastructure that we need for the future. And in planning for the future, we look at healthcare, and how we will deliver it. It will be far more distributed models. It will be the elastic walls of the hospital. And the infrastructure for those elastic walls of the hospital are the data about our patients and the wider data landscape around the operations of hospitals. And we need to invest in that as a capital asset, as a primary asset for healthcare systems, in the way that we invest in our buildings. So we need to take a journey as a global set of healthcare systems to say data was less important in the past to healthcare, but now it is becoming mission critical. It's becoming, part of our most essential infrastructure. And the cybersecurity aspects are very interesting because, showing with those from India and those from Europe, we all need to make sure that we have the cybersecurity regulations, rules, and standards to actually keep our data safe. It will become ever more a target of cyber terrorism, of, sort of national security. And all of these things need to mature in order for us to get to the sort of, AI age, the cognitive age, if you like. Because unless the data is engineered well and it's secured, we're not going to be able to leverage these things for the future. So really, a global understanding around the steps we need to take and in which order is very much needed. And the AI space, that's still emerging in terms of its regulation, its standards, and all of those things. We're not ready yet to take this at scale and pace. There still needs an awful lot of work, but we do have time to get our data ready for it to be used upon. And so data readiness is a major topic that I think we're all going to be talking about in the coming years. What does data that is ready for AI look like? How do we get the skills to ensure that we have people that are able to actually make that journey? How do we actually meet citizens' needs when it comes to data, both for things like, shared records, so things like the European Health Data Space, and how do we make sure that citizens have transparency in how their data is being used? That's a big area that needs to be explored and worked through. So I very much do believe that, we need to engage with AI. We need to explore what it means. But this whole journey is going to take us a number of years as a set of professions globally. And that journey will need standards bodies, policymakers, those working in digital health to all collaborate and ensure that we are working on standards together. And I know that India and Europe are very much engaged in, that standard space and in dialogue about how we take this journey together. But I think what's really important and what we found from our first policy forum at the International Policy Forum at MedInfo in Sydney was there are many things that we need to do once globally and not replicate across different nations. And those things do include standards for data. They do include best practices. They do include standards for cybersecurity and data security as well. And so as we sort of explore this landscape and moving forward, I think it's going to be really interesting to see what, discussions are had at the Europe India Digital Health Week and how they reflect this and how they reflect what is the coming horizon for healthcare. We have to also acknowledge as well that most healthcare systems globally are not sustainable unless we start using digital and data and AI in the future to actually ease the burden on those systems. And easing the burden means things like automation, it means decision making, it means management by exception rather than seeing every patient. It means empowering patients with information and, sort of things like risk stratification so they can make decisions. And those new sort of tool sets for the sort of sustainable healthcare system of the future are going to have to be formed by the digital health profession with those standards supporting. So it is essential we do take the journey, but taking the journey too rapidly or without all of the things we need in place is a really unwise idea. And so while I'm very pro AI and while I'm very pro the progress we need to make, I'm pro actually, forming sandboxes, working out what is needed, working out how we move forward together. And actually, we've got a regulatory sandbox that's actually happening here in the UK at the moment around AI. And that is going to look both at generative AI and traditional AI models. And it's being run by the MHRA. And it's really just to consider what the parameters are that we need to take into account for our future governance and our future regimes. One thing I've done a lot of work on is lifecycle management for AI, and we're not ready for it yet. That's where we look at things like clinical safety, we look at governance, we look at the performance of the AI, we look at bias, and we create an oversight system that can look at all of the sort of AI tools that are being used in an enterprise, a health enterprise, to monitor real time their safety and report on their safety. These tools don't exist yet. They're not out there, but we have sort of conceptual frameworks of how they will work in the future. And again, those need to be worked through with different healthcare systems to ensure that we have the tool sets to allow us to operate AI safely. So overall, AI is going to be part of our future, but we have a saying in the UK, more haste, less speed. If we go too fast, we will do things wrong, it will break, and we will have lost confidence. If we do this in the right order and at the right pace, considering data very carefully as the main enabler for AI, we can make the right pace of progress, which in turn will make sure that we have a tool set that will allow us to enable the sustainability of healthcare systems. Finally, I hope you really do enjoy Digital Health Week. If you want to tweet or comment on this, my Twitter handle is @UKPenguin. I'd really welcome any feedback and welcome any contact from people who are on this journey with me. But I know we're all hugely enthusiastic about the future. I just think that we need to take stock of everything before we move forward. And I do think we will have a good future in the sort of data and AI space if we take the journey at the right pace. So thank you very much and enjoy your week.